Women's Health on the Go. I know I apologize this evening. It is 8:14 and I typically go on a little bit before 8 o'clock, but unfortunately I was having a little technical issues, but we are live and we're going. As you can see tonight, I've got a guest tonight, but you know, as I do, I usually go on, we make sure that everything is golden before we start jabbering away. I hope everyone had a good 2 weeks. As you know, I had a little mini vacation last week, which was much needed, but I did miss doing the show. I have to say, I do love doing these shows, and
which was
good,
much needed.
We're good, we're live, good. If you are here, please make sure that you say hello in the comments. Hello, Dave. How are you this evening? Make sure you say hello. And if you haven't signed up for our newsletter yet, for Women's Health on the Go, make sure in the comment box you just type in yes, and hopefully we're going to get you a free ebook, and you'll sign up to our newsletter. But for tonight, I have a guest. I have Millie with us. She is a nurse practitioner with over 16 years of experience working with cancer and chronic illness patients, and she's branched out on her own and she owns Aaliyah Wellness, where she helps people with cancer and other chronic illnesses in navigating their health care. Welcome, Millie. I'm so happy to have you this evening.
I'm so happy to be here. Thank you so much, Lori, for having me.
I'm really, really excited. We're going to have a great show tonight. But to begin with, every time I have a guest on, I ask them to tell us a little bit about themselves, a little bit about their background, and how is it that you got to be where you are today, and how did you branch out into this business that you have?
Right. So after graduating in 2001, I early on realized that my approach to patients was really more holistic and not so strictly clinical. And having mostly dealt with cancer patients, this really worked well with that population. But of course, in the clinical setting, you really have to be mindful of the time, and you can't delve that deeply into what's going on with the patient as you would like.
Yep.
Now, in 2012, my sister got diagnosed with breast cancer, and I found myself her primary caregiver. Unfortunately, sadly, she passed away in 2014, and it really took a toll on me. I had my lifestyle while I was caring for her deteriorated. I gained over 20 pounds, well over 20 pounds, and I just felt sick. And sure enough, a year almost to the week of her passing, I became critically ill myself, and I had developed chronic illnesses. So now I went from being the provider to being the patient. So, as I became obviously more curious about what had happened to me and how I suspected my lifestyle choices had played heavily into this, in combination with an extreme stress that lasted for 2 years. But I wasn't really getting to it with the doctors that were treating me. It was sort of like there was some compassion, there was diagnosis, assessment, but then I was sort of moved along. So I did a lot of my own research, and while I continued to work, I began to see things through the eyes of my patients, more so, and I could no longer practice the way that I had been with these 15-minute visits. I was getting in trouble with my manager, who was yelling at me, "Watch the clock."
Yep.
So I decided that I wanted to become certified as a health and wellness coach and learn those skills, because I decided I wanted to start my own business where I could take my time and really connect with patients the way that I wanted to. And so that's how Aaliyah Wellness was born.
It's so funny that and I know that you and I have had conversations before, but I think a lot of us healthcare providers who are in what apparently is called healthcare today, And we get so frustrated with the fact that now it's all about ticking boxes and getting them in and out and just, prescribing a pill and getting them out the door, that we get so frustrated because we know that that's not what healthcare is supposed to be. It's supposed to be something that's completely, it's about the person, and so I can totally relate to that, and I think that a lot of patients can relate to that as well, because I think they get just as frustrated as we do, because they're like, hey, I just got in here and you're already walking out the door and I've been waiting an hour for you. What's going on?
Exactly. And especially with the population that I've most experienced with, oncology, and then chronic pain management, these people have like a lot to say, rightfully, and I wasn't being given the time to really connect with them.
Oh, yeah. No, I mean, especially when it's something that's, whether it's cancer or whether it's a chronic illness, this is something that's long term. You know what I mean? It's not like I'm going in and I have a bladder infection and I just need an antibiotic and I'll be better in 5 days. This is a completely different kind of healthcare, So tell me a little bit about, what exactly do you do when you're with your patients? Like, if, let's just suppose I were to come to you saying, hey, I've got hypertension and diabetes, what exactly do you kind of do?
So for me personally, in the way that I practice, I do rely heavily on my medical background. So I do a lot of teaching and providing information about their disease process, whatever it is that their condition is. And then we go into a lot of coaching with lifestyle modifications and how that works for the way that they're living. And really, I'm trying to impart teaching skills in terms of problem solving. I'm trying to build self-efficacy and autonomy so that they begin to be able to address issues that develop on their own with a little bit more feeling of control. But I'm really starting by teaching them those skills. Together, we partner to look at obstacles or challenges and really strategize possible solutions. And at the heart of the way that I practice, there's an emotional support system. Like, I want to provide them emotional support to deal with the impact of their condition.
Yeah, no, absolutely. I think that, especially like if you got cancer, that is definitely an emotional kind of, that's a really hard thing to take. And I think that's, especially when you have family too, that you might not be ready to talk to them about it, about what's going on and stuff. Now, do you also, I know that that's something that we've kind of talked about, even like, helping them when they go to the doctor's office, or, talking to them about questions they might like. Do you also kind of help them with that stuff? And
so that's one of my offerings, one of my services. I like to really customize what I offer to what the patient needs. And so I decided that based on my experiences with patients and with my sister, who, as you say, really didn't want the whole world to know about her diagnosis when she first received it, but she let me in. And so that was a really valuable experience because now that's what I offer to people who don't have family or who don't want to necessarily spread the news right away. When they get that call and they say, we need to see you in the office, I will go with them. And, I act as a liaison, bridge the gap between them and their doctor. Because with any new diagnosis, you almost can't hear every word the doctor is saying. It's like all you can hear is your heart pounding in your ears. And so I'm very aware of that. And so I want to go through with them what it is that they want to know, what are their expectations, and what are the best questions to ask. And so I let them guide me how they want me to partake, but really it's with the role of being a liaison and helping to bridge any gaps and understanding in their treatment process. I'm helping them to navigate the healthcare system in terms of locating community resources and coordinating care. And of course, this goes along with continued one-on-one coaching for their personal goals.
I think that too, and I know that you and I have talked about this kind of previously, is about the also just informing and educating people, like that a lot of times providers don't have that kind of time that we were originally talking about, and they just say, well, if it's cancer, it's like, oh, we gotta try, we gotta start chemo tomorrow, or you have to be put on this medication, like go to the store right now and get it, and trying to help people navigate those options, because I think a lot of people, they just go with whatever the doctor says.
Right, absolutely, because there's a fear factor. And so I really take it as a personal mission to help them feel more in control and less overwhelmed. And so that's sort of the model by which I practice. Let's take the fear factor out. Let's see what your goal of care is and what treatment options that your physician has offered you most align to your goals of care.
Yeah, because I think that there's also I think that with some things, it's they put the pedal to the metal. Is that the word? They put the pedal to the metal and say, we got to go straight for all this kind of stuff, when patients should really realize that we have options, you know what I mean? And we don't have to make a decision within 2 seconds.
No, absolutely. I mean, there is scientifically research windows of opportunity for the various treatments, and I understand that. But in none of those options are, like you said, in the next 2 seconds. None of them, guarantee you. And so I really want to support the patient in deciding not only which is the best treatment for them, but also, do they want a second opinion because there's something that's not comfortable or resonating with them? Or do they not want treatment? I go back to my sister, because that was sort of the experience that brought upon this particular service. When she had reoccurrence and she had already done her chemo, radiation, her surgery, she decided she did not want to do it again. And my sister died at the age of 52.
Oh, wow.
So the whole world said, you must, you absolutely must.
Yeah.
But I stood up for her and I advocated for her and said she must do what she feels she needs to do. And so I was really a voice for her, and that's what I want to be for my patients, a voice for them, to give them the courage to follow the path they're most aligned with, whatever that may be.
Yeah, I think that's really to have an advocate behind you, because I think like that situation with your sister, I think that can be, when you want something and the world is kind of against you, right? That makes it really, really difficult, because then you second guess, like, well, this is what I feel in my heart, but everyone's pressuring me to do something. And then to have someone to be like, listen, I'm here to just be your voice, to advocate for you no matter what, I think is really...
My rule is I do not dictate what is the appropriate path to take, what is the appropriate treatment. My rule is, let's talk about and uncover what your motivating factors are, what your truest wish is. And people are very well-meaning. You'll have very holistic people who advocate not to get any kind of treatment. And then you have those who are like, come on, we want you to, take the chance, the clinical trial. And so you get both sides. But what I want to hear is, what does the patient want? And sometimes they're too panicked to understand. So it's really about uncovering that and then working towards that. Yeah,
I think that is, and I think another thing that you touch on so many things that I think are so important. I gotta remember both of them inside my head now. But one of them is that one thing I truly believe in, and as well as like making sure that you know all of your options and you have that whole array, and that it's not me. This is your life. When I tell my patients, like, listen, yes, I'm a healthcare provider, but my job is to tell you that these are your options. Like, this is what the research, I know you and I are both really into research. And what does the research show? You know, the research shows that we can treat you this way, we can do this way, we can do this way, and we can do this way. Now, how you decide to do that, I can't make that decision for you. And I think that is one thing that you and I, we just have these conversations that we've had in the past. It's like there's so many things that we totally align with, and I totally believe that, you know, as a healthcare provider, a healthcare provider should not be dictating, I don't know if that's the correct word, but to the patient, you know, what should be done. I think it should be, you know, okay, listen, here's the cards on the table. You know, every treatment option is not for everyone, you know.
Right. And I also take it as my duty to research and provide the client with what are complementary therapies to whatever they're going through. So let's say chronic pain management, for example, which was a secondary but still very important population that I worked with. Right. Oh, I'm sorry. My insulin pump. There we go. So, you know, the research shows that for lower back pain, gentle yoga is effective. We're learning more and more about that. There's some research about acupuncture. Mm-hmm. So I know when I worked in the office with 15-minute visits, I didn't have a lot of time to delve into that kind of information or even see if they were interested in it.
Yeah.
You know, for cancer patients, similarly, there are therapies to help cancer-related fatigue, which is a different ball game than, you know, you and I when we're just beat by the end of the day. It's an ongoing, doesn't matter how much sleep you get, it just really doesn't go away. And so they're different. So we know that one intervention is exercise, which goes against what you might think, but I'm talking about low impact. Mm-hmm. Walking, getting out, and being active in a way that you can tolerate. And so looking at your day and seeing where activity would be best, when you have your most energy, and when you should take your breaks. So it isn't just spilling out ideas and, treatment plans. It's about really working with them so it fits into their lifestyles as seamlessly as possible.
Yeah, no, absolutely. And that kind of like, although I had a different point, okay, all these things keep popping in my head. I got to keep them rolling in my head. One thing that I think is also really unique with your background as well is that, you know, you have that, you're like you've got that health coach kind of thing going on, but what makes you very unique is that you do have that nurse practitioner, that medical background, that as much as you're just doing the health coaching and helping people along, I think it's really great and amazing that you have that background, because it's almost like you've been there, you've been doing it, you know, right. And I think that's just a great, unique aspect of you.
I thank goodness for that platform, because I have such a deep understanding of the pathophysiology. And the coaching has really helped me with the positive psychology, but that medical background, evidence-based research, we've talked about that. I really wouldn't recommend anything to anybody or teach anything to anybody or give information about anything that wasn't evidence-based in research. So you hear me quoting a lot about the National Institute of Health, and, the Mayo Clinic. So I do a lot of, when I'm researching, those are the types of sites that I'm looking at.
You're probably like me, reading all the time. You can't stop. You just keep reading more and more, and there's more research, and it's wonderful. I love doing it, as I'm sure you do too. But it can be there's a lot of research out there to read. It's amazing.
Right.
So another thing that I wanted to because this is something that we had kind of talked about as well, is that, to me, I know I just did, let's see, I think it was in July. I think it was July. It was either June or July. I'm not really quite sure. But on Friday, on my Facebook page, I have fun facts, And one of them is about 1 month I did 4 of them on social, being social and the health benefits of being social. And I know that you have an event coming up. You got a walking event kind of thing that's coming up that I think does so many things, plus being social.
Yeah, it's my baby. It's my wishing well of just goodness. So I was very fortunate to find a partnership with the Bedford Audubon Society and in Katona, New York, and they're partnering with me to start a walking series for cancer survivors. Mm-hmm. So every week there's going to be coaching, there's going to be a topic that I facilitate for conversation. Like we talked about cancer-related fatigue. We're going to do gardening as it relates to a healthy, whole foods, plant-based diet. So people will be growing their own herbs, and let's try for vegetables. So I've got this whole curriculum planned, and it's really exciting. I'm going to be coming up with the working the details out. But if anybody's interested in registering, email me, or wouldn't mind dropping my email down. It's a 6 classes. The first one's free. Come and get to know me. If you like what you hear, if you like what the class is about, join. It'll be a small group, 6 to 8 people max.
And what I can do is I can even say, if you are interested, you can instant message, even me. I've got also in the description, I have her Facebook page. I got Millie's also website. So there's so many ways that you can totally get in touch with Millie for that. But I think that is really great, because there is research out there that says socializing just in itself is healthy and it's healing.
Exactly, but walking through nature.
Oh yeah.
And the National Institute of Health has put out several studies that show that it actually elevates your natural killer cells and inactivity and numbers, and you form an anti-cancer protein. So this is actual immunological effects of nature walks that last up to 7 days, the research is showing. So this is incredibly interesting to me. And besides the other known effects of reducing stress and elevating, mood disorders like anxiety, it absolutely has real physiological effects.
That's amazing.
I know.
That's amazing. I think, I'm always amazed by nature and what our bodies can even just do on their own. I think we're really, really, we're amazing beings.
We are. And I think intuitively we know we belong with nature. There's that connection, and we've just sort of taken to living in our, 4 walls and a ceiling. Yeah. But really there is that restorative, I'm not going to use a different word, restorative property that is absolutely there.
Now, have you ever heard of what's called earthing?
I've heard of earthing. My program is based on something called Japanese forest bathing.
Forest bathing.
Right. So
I got to write that one down.
Yeah. So in Japan and in, I believe, South Korea, but definitely Japan, this is actually the cornerstone of preventative medicine. It's not like you don't go to a health coach to tell you this. Your doctor's going to tell you this. And that's been established since the 1980s.
Really?
So I'm very interested in moving forward with this and seeing where it goes. And I had patients, I shouldn't say patients, people reach out to me and saying, well, I don't have cancer, but I have a chronic illness. What about me? If this group is successful, I've got lots of, I'm like you, Lori, my mind is going different ways.
Yeah.
What I want to know is how can I best serve?
Yeah.
And so, I'm excited.
Yeah. I've never heard of forest bathing, but that sounds really, really very interesting. But, they're very, with acupuncture as well. That's,
yeah.
I don't know if I've ever told you or the audience. When I used to live in the UK, And they were very into kind of alternative kind of things. And there was a show. Every week they would have a documentary about a different alternative modality. And they had acupuncture. And they had, it was amazing. Over there, when you go for surgery, you can have acupuncture points as anesthesia for surgery, or you can get general anesthesia, but you have to pay for general anesthesia. Well, I watched this girl have surgery with acupuncture points. She was awake, and she was having surgery on her body, and she didn't feel a thing. And her recovery, they followed her through the whole thing, and her recovery and everything was so much better as compared to the person who had general anesthesia.
That's incredible. That's really interesting.
It was a little nerve-wracking watching it, to be honest with you. Because this is not our norm, you know what I mean? For them, this is their norm. They're like, yeah, whatever. Like, everybody does this around here. But for us, it's very, we're very different.
Yeah.
Right.
Which is why I really like looking at the research, because people tend to take it more seriously if you go,
yes,
this has been studied in this journal,
yep,
and this is actually like a real thing, and you can show them the dates, the statistics and everything, then they tend to receive it better.
Yeah, I know. Because if you told them we're gonna go forest bathing, they may look at you and go, what?
I'm not into that.
But I think that's so. I never heard of that, but I believe in it. I think that would be really amazing.
I love your audience to just when you get a chance to Google it, because it's really exciting. It's phenomenal, and I think it's just even if that research didn't exist, we know without a doubt all the other stuff it does, like it helps improve sleep. It alleviates depression, anxiety. It reduces stress. That alone is worth its weight in gold. But when you start talking about the immunological effects, then that's just, it takes me to a whole different level. I'm really excited. I think that the cancer survivors, I had one of my very dear, who's become a very dear friend of mine, was a former patient many years ago. And he told me, I don't want to always, I'm paraphrasing, I don't want to always be the cancer patient. I want to break away from that. I know I'm a cancer patient. I get it. But I want to break away from that and, sort of feel differently. Yeah. So he takes his motorcycle and he goes to Bear Mountain and he feels like that feeling. And that's really what I want to give over to my group. So that's one of the reasons I'm keeping it small.
Yeah, no, I think that's absolutely amazing. And I think that, what you do is important, and I think that the message for me, I'm always trying to open up all my viewers to different modalities and a whole bunch of different stuff. And I think that with having you on the show is that, I think that you told me statistics is 85% of doctor visits is related to cancer/chronic illness.
Right.
And that's a huge amount of people. And I think that it's important for people that do have chronic illness and are going through things that, one, you don't have to go through it alone, right? I mean, there are, people like you out there that can help and support them navigate the healthcare system, putting them in the right direction for them to become healthy and happy, and I think that's really important for them to know that there are people like, here's Millie,
Right. And I don't blame them. There's healthcare providers and then there's holistic practitioners. And it's sort of like you're very conventional or you're,
yes,
mixing up potions or something. And it doesn't have to be like that. There can be a melding of the two.
Yep, absolutely.
And best parts of both, and customized to what you want.
Yeah, no, I'm with you totally 500%. To me, that's what I like. That's what you're doing. What you do with cancer patients and chronic illness is what I do with women and their health issues. It's like, okay, here's conventional, here's holistic. What do you want? You want this side, you want this side, or you want something in between? Because I think that being able to have those kind of options are really, they're important, that, that we know that we have them, and that there are people out there that are knowledgeable, like us, to help navigate them through that system. So I think that's really kind of important. So as always, as I tell everybody on my show, I hope that this has opened up your mind to knowing that there's help out there, and you don't have to go through either your cancer or your chronic illness on your own. I hope that if anything, either you join Millie for her nature walk, or get out in your yard, in your grass, and go for a little circle walk or something. I think that is, I know it's dark out, but I'll have to go out for a walk in my backyard tomorrow and, put my feet in the grass. But I think that is definitely. I will have Millie's Facebook and website in the description. So if you want to reach out to her, please do. Or you can always message me. You can message her on her Facebook. Whatever you feel comfortable to get in touch with either one of us. So thank you, Millie, for coming on the show and sharing what you do. You're definitely amazing. Definitely amazing. You've got a great heart.
Thank you, Lori. I loved being on your show. Appreciate it.
No, absolutely. So thank you everyone for showing up. Next week, I've got a hot topic. At least I think it's a hot topic. We're going to be talking about feminine products. So make sure you tune in next week to watch the show. Otherwise, everybody have a wonderful, wonderful week. I'm sure that I'll pop on sometime to say hello. And don't forget to reach out to Millie to say hello and get in touch with her. Thank you very much, everybody, and have a great week. Take care.
Thanks.